Hello, everyone. Today we're exploring healthcare in South America. It's a region rich in innovation and resilience, offering valuable lessons for the world. We start with Brazil. The SUS health system offers free universal care to the vast majority, covering doctor visits, hospital stays, and vaccines. The family health strategy has 50,000 teams delivering care to low-income and remote areas. But with only 9% of GDP spent on health, unlike America's 18%, they struggle with long waits and limited resources, especially outside big cities. Chile takes a two-tiered approach. About 70% of people use FNASA, the public plan, while wealthier folks opt into private ISAPREs for quicker appointments and more provider choice. It creates a bit of a class divide. Better access if you can pay, longer waits if you can't. In Argentina, the system's split three ways: public hospitals, free for everyone, job-based social security funds, and private insurance. Most people rely on the Obras Sociales security funds, but overcrowding in public hospitals and inconsistent funding mean many still struggle to get timely care. Colombia has an interesting system where about 95% of people have insurance through either a contributory or subsidized plan, managed by EPS insurers. These entities play a key role in providing healthcare access nationwide. They're compensated through capitation, which promotes preventive care and focuses on maintaining health rather than just treating sickness. However, if insurers face funding shortages, patients can experience delays and cancellations, which is a significant problem. Uruguay's got a nice blend going on. Everyone pays into a national health fund, and that money gets distributed to both public and private providers. Over 90% of the population has access to quality care, and people there generally report high satisfaction. South America's strengths are evident. First, universal coverage. Nearly 90% of South Americans have some form of health insurance. Next, high life expectancy. With an average of 76 years, it's close to global highs, supported by strong vaccination rates. Lastly, telemedicine and pharmacy growth. Over 60% of clinics now provide virtual consultations, reaching remote areas like Andean villages and pampas ranches, focusing on more local generics and vaccines to reduce import reliance. However, they encounter some obstacles. Rural places often lack money and facilities. Most specialists and resources are in cities, leaving rural areas with poor services and a big gap in healthcare access. Doctors move abroad for higher pay. This loss of talent leads to fewer skilled workers, making the healthcare system weaker. Patients may end up with less experienced doctors, which can lower the quality of care. Complicated management, disjointed systems slow down care and data sharing. These hurdles cause delays and inefficiencies affecting patient care. It is tough to organize care, keep track of patient records, and ensure prompt treatment. Now let's compare that to the US, where we spend the most in the world, about $12,000 per person annually. Yet millions still go without coverage or struggle to afford care. South America's models, with their emphasis on government oversight, cost control, and community-based care, offer a blueprint for how to stretch a healthcare dollar further without compromising access. So if you're in healthcare leadership, public policy, or just curious how other systems tackle these challenges, there's a lot to learn from the South American playbook. If you found this helpful, hit like, drop a comment, and subscribe for more global healthcare breakdowns.